Um, when we examine the supraspinatus, most sonographers throw the arm into full CRAS position and do the examination. What you really should do is examine it under different degrees of tension. So you do a real quick exam with it relaxed. You do an exam of it in modified CRAS, and then you do another exam in full CRAS.
Which is always painful if you've got a bad shoulder. You know?
Yeah. But the reason for this is because let's say you have a delaminating tear. Okay, so here's the supraspinatus and long axis. Can you see that?
Yeah, I can see that.
Okay, so let's say this is the supraspinatus and long axis, and it starts to delaminate like this. Okay, and then you put the patient into full CRAS position, and you put it under stretch, and it goes like this. And you miss the delaminating tear because it's not relaxed enough. So there's certain types of tears that you're going to see with a relaxed tendon, and certain types of tears that you're going to see better under full CRAS. So if it's a muscular tendinous junction tear, you see it on full CRAS. If it's a delaminating tear, you see it under relaxation. If it's like a little partial tear or like a rim rent tear, you see it best on modified CRAS. It's another thing that gets missed on routine sonography because they bring the patient in and they whip through the exam in 15 minutes and they may not see something. So you guys, I think from the physiotherapist point of view, keep in your mind that just because the ultrasound said nothing, it doesn't mean there's nothing. It depends on who did it. So the other thing that happens with rotator cuff tears is if you imagine, again, here's the supraspinatus tendon, and let's say the tendon gets a tear, and because of the tear, there's a loss of tissue, and because there's a loss of a tissue, the area in that tendon drops down a little bit. And so what we end up seeing is a change in the contour of the tendon. So instead of it looking like a really nice smooth crescent, it'll kind of come around like this, and it's going to be like a little dip. And we call the top of the top border of the tendon, we call it the roof line. And if we look at the roof line and we see kind of just like this, sometimes it's very subtle. That's why examining under relaxation is important. You'll just kind of see that, it'll be curved, and then it'll just, but really, really subtly, like it's not obvious. Like you'll just kind of see, oh, that's a little off, and then the crescent will continue, and you're like, okay, there's something going on. Yeah, exactly. Yeah. And then this, a good sonographer will see that and go, okay, the search is on. Because finding partial tears and things like that in rotator cuff, you have to be careful. Like you have to go slowly because it's really easy to miss them. So I think there's a lot of patients out there they have undiagnosed partial tears, they have undiagnosed delaminating tears, things have been missed. A quick ultrasound gets done, it goes back to the family doctor, it says no partial tears. The family doctor is like, okay, they have tendinosis, or it's an overuse injury or whatever, and they write it off. So what I would do first, again, is find the biceps tendon right here. Okay. So I'm seeing the biceps tendon. And if I move, sorry. Okay. So here's biceps tendon, right? This is medial, because you can see the coracoid, right? And then this is lateral, right? Now I'm on the supraspinatus. All right. I'm going to change the depth a little bit. Okay. This little arrow that I'm moving around is called focus. And what it's doing is it's focusing the ultrasound beams at a chosen depth to make the structure that I'm most interested in have the highest resolution. Okay. So now once I see this, I'm going to come down, and you see those facets forming again. So this is one facet here. Okay. So this is anterior facet. This is middle facet here. This one that's at 45 degrees going down. So this is the attachment site of supraspinatus. This is the attachment site of infraspinatus. You guys follow me? Are you oriented? Okay. So I'm going to be looking in this region right here, because the supraspinatus tears happen close to the biceps tendon in this region. They don't normally happen here. If there's a tear here, it's usually supraspinatus tore here and extended backwards into the infraspinatus, or they tear here and move medially into the subscap. It's a little bit unusual for there to be a tear of only the subscap. It happens, but it's not as common. The common thing is supraspinatus tears and moves forward or moves backward. If the supraspinatus tears full thickness, but the infraspinatus is intact, there won't be much retraction. If the supraspinatus tears and the infraspinatus tears both full thickness, there'll be extensive retraction. Okay, so we come here in this area, and I'm going to come down until I don't really see much of the tendon. And then very gradually, I'll come up and look in that area carefully, like this. And I'll keep my eye on the tendon, and I'll look at the thickness and the echo texture, and I'll look at the, that roof line, and I'll make sure that I don't see any subacromial subbursal liquid to suggest a full thickness tear. Okay, so down here, we're on the enthesis. I'm distal. And then as I come proximally, I'm still probably on the enthesis, but then when I get up here and I start seeing cartilage, so right here, you see this black line, and then there's another bright little thin line. This is the interface between the cartilage and the tendon. Okay, so there's a little echo signal that gets generated because the speed of the ultrasound changes as it moves through tendon to cartilage. And whenever there's a speed change in the ultrasound, it generates a signal. Okay. So here I know I'm inside the joint. So now I'm not looking at the enthesis anymore. And most of the tears happen in the area of the enthesis. So I take a look up here anyway, but this isn't where I'm looking carefully. I look carefully as I come distally this way. And then, and then I might go back and forth in this region and keep looking at different angles and right. And then in this relaxed position, okay. So here's the enthesis, right? That's the greater trochanter we're looking at. And I'm going to go long axis on it here. Okay. And you see how it looks like a shelf? And as I go backwards, the shelf's gonna go away. So see that? That's how you know you're kind of you're moving into infraspinatus territory when you see the shelf disappear. When I come back this way and I start seeing that shelf, I'm on supraspinatus. And then I come back this way until I see biceps tendon right there. Okay, so this is biceps tendon. So I know if I come back this way a little bit, I'll be right in the region where the tears happen, okay? And I'll be looking at this carefully. And then this arc right here, that's the roof line, okay? So I'll be looking at this roof line to make sure that it doesn't have a curve, and then it kind of dips and flattens, and then it curves again. If there's a drop in the roof line, then there's a loss of tissue somewhere, okay? Okay, so, and then this is where we would be looking for delamination tears. You know, it kind of would go back and forth through the tissue like this, you know, and just look to see if there's something that looks like a cleavage plane. And then continue with the rest of the exam. And then after the exam, when, you know, after they had been put into the crass positions, we may have milked some fluid into it. And then we would look at the relaxed position again at the end to see if we can see fluid now. Okay, so this would be, okay, we take a quick look at it under relaxed position, okay? And then I push you under modified crass, which is like this, okay? So when you do this, the humerus rotates forward like that. The supraspinatus emerges from underneath the acromion, and it puts the tendon under tension, okay? And then we come back and we look at it again. Okay. All right, so again, I come to the biceps tendon, right there, right? That means that this is the greater trochanter. This is the lesser trochanter, right? So this is greater trochanter here, anterior facet, middle facet. Okay, I'm going to get it in the middle of my screen, right? I'm going to reduce the depth a little bit. Okay. And now I'm going to do the same thing. I'm going to look at the enthesis in short axis first. Okay. So here we don't see anything, right? So this is enthesis. When I come this way and it just kind of drops off, I come back up. Right now I'm on the enthesis, and what we do is a very good sign of partial tears is periosteal cysts at the enthesis. So if, let's say I come here and I come up and I see a really ratty looking enthesis and I see a lot of periosteal cysts, my antenna go up and I say, okay, slow down, look at it carefully, because there's probably a partial tear here, okay? So we look here, and this will be the enthesis, and I look close to the biceps tendon because that's where they occur, and I might kind of keep looking through here a little bit as I come up, okay? And then, you know, once I get up into the joint, I'm probably past the point where the tears occur. Okay, now we're seeing cartilage, right? So this will usually be healthy tissue, but then when I come down carefully, I keep moving the angle of my probe, so I keep on seeing the tissue properly, and this is where I'll be looking for signs of a tear, right? The width of the supraspinatus tendon is about the same width as my probe. So I don't really have to go this way to look anywhere. Okay, all I have to do is look with my probe. Okay, and then I'll be looking, you know, same thing. Is there any abnormality in echo texture? Is the tendon thicker than it should be? Is it darker than it should be? Is it uneven in appearance? Is there subacromial subdeltoid liquid? Are there periosteal cysts across the enthesis? That's what my eyes are looking for, okay? And so I examine it a couple of times in short axis, okay? And then I come down here and I'm gonna look at it in long axis now. So here's the biceps tendon down in that groove, you see it? So I spin on the biceps tendon to look at it in long axis, there, okay? So this is the That stringy thing right there is the biceps tendon in the long axis. And then if I come back, there I am. Okay, so this is biceps. That's supraspinatus. Okay, biceps, supraspinatus. Okay, and it tears close to the biceps, so that's why we're looking at this carefully. And here, this is the anatomical head. This is the zone where the enthesis starts, and then this is enthesis all through here. This area right here is where the rim rent tears happen, right here. The problem with this area right here is the tendon tissue kind of comes out and then takes a dive, okay? And as it takes a dive, it makes it hard for the ultrasound to see it clearly, and you get this area of shadowing right here. See this? So this is normal, but sometimes might hide a subtle tear. So you kind of have to, bend your probe, and you have to, kind of look at it at different angles and make sure that you don't see something that you're missing, right? So, and then I can kind of come back this way and just look through the length of the tendon. And then when that shelf starts disappearing, we're in infraspinatus. See it? The shelf comes back, shelf disappears. So this is infraspinatus, that's supraspinatus, right? So then once we're done with that, we can kind of look back this way towards the musculotendinous junction just to have a look. Okay, so there's two types of tears. They're musculotendinous junction tears and enthesis tears. So you look back here just to make sure you're not missing something down here.